Medicare is the most successful social program ever enacted in the United States, so it is not surprising that expanding that program to the entire population has been proffered as a solution to rising healthcare costs and the ultimate goal of universal coverage. In this video, we will use simple math to explore how close we currently are to providing publicly funded universal coverage for all citizens, and how the importance of the private market has been distorted to justify its existence. Employer-provided health insurance is something Americans seldom question, which is surprising, as it is not a natural fit. Coupling healthcare with employment puts small businesses at a disadvantage, and contrary to popular belief, makes for a less mobile and therefore less dynamic workforce, as it creates an environment where people are reluctant to change jobs, move, or start a business due to costs and uncertain coverage. It also means that an employer determines what plans are offered, what percentages each party will pay, and these can be altered without input from the insured. As of 2018, only 46.9% of employers offered any form of health insurance to their employees, so it clearly is not the ultimate solution. With these disadvantages, it is smart to ask, how did employer-based insurance become so prevalent? It wasn't by design. After World War II, the government restricted wage increases to avoid runaway inflation in a tight labor market. As health insurance coverage was not classified as income, it was a convenient loophole that employers exploited to lure workers. So employer-provided health insurance was introduced, along with other inducements, such as paid sick leave and vacations, as an incentive to attract employees. When the inflation crisis had passed, the incentive, with all of its drawbacks, had become entrenched and has surprisingly remained largely unchallenged until now. This unlikely coupling has created long-term tensions between an employer trying to provide acceptable health insurance to its workers, but doing so as inexpensively as possible. To accommodate the employer's budget and/or benevolence, there has traditionally been no standard minimum level of coverage. Everything from comprehensive plans to ones that could barely be called insurance as they cover so little of the insured's potential healthcare needs have been on offer. This has led to the creation of an incredibly complex and possibly intentionally obfuscating insurance marketplace, with plans offering a bewildering myriad of coverages, exclusions, contribution percentages, co-pays, etc. Adding to this burden, insurance plans are generally negotiated on a one-year contract, so are subject to change or renegotiation annually on some or all of these points. Private health insurance is not as prevalent or important to the U.S. healthcare system as most people think, or more precisely, have been led to believe. Looking at this graphic depicting the raw data, most viewers will be surprised to see that publicly provided healthcare and the uninsured make up 57% of the whole, whilst the private market is only 43%. Furthermore, if we look behind the numbers, the private market becomes even less relevant. If we move the people who are currently hidden in the private market, that your tax dollars are additionally paying to receive coverage, to the publicly funded market, we see the true picture. First, let's split out the 28 million federal, state, and local government employees, retirees, and their families currently receiving health insurance, which is 8.7% of the entire population. Next, let's take the $146 billion provided annually in subsidies to individuals and corporations from the federal government under the Affordable Care Act, and use that money instead to buy Medicare for those people at the current cost of $10,348 per person. This equates to 4.3% of the entire population. The updated graphic is now a true representation of the overall market, and not only shows the relative unimportance of the private market, but just how close we, the public, already are to paying for universal health care. In reality, the private market covers less than 31% of the entire population, leaving the remaining 69% either publicly insured or uninsured. Let's be clear about what is being revealed here. The general, mistaken consensus is that the private market is larger, works more efficiently, and offers more choices to consumers. However, the data clearly reveals that the government is the core constituent, involved in every aspect of healthcare provision, and provides more comprehensive coverage with greater efficiency. The reality is that 70% of the population would have no health care whatsoever without government support. Private market insurance receives the majority of the political and press consideration when it comes to our national conversation on healthcare. Insurance companies' invested interests have distorted the debate by utilizing vast sums of money to exaggerate their importance and marginalize the public sector with the goal of maintaining the status quo. Going forward, whichever way we choose to tackle spiraling costs and the lack of universal healthcare coverage, it is imperative to have an honest, evidence-based conversation about where we are now, what we wish to achieve, and how much it will cost. Providing the security of lifetime Medicare coverage for all citizens would allow for a massive simplification of the system, strengthen Medicare, cut costs significantly, empower employees, and allows employers and the government to concentrate on other priorities. How close are we to publicly funded universal coverage? The math shows it's a lot closer than we have been led to believe.